Becks and Jon. Jon, I'm sure you must know, Jon is Christine and Richard's son. He moved out to Zambia 3 years ago, just gone, right? September, yeah. So yeah, I suppose this is a really good opportunity for us to just thank you guys, because I know you as a church have been really supporting us. We've just come back over for 2 months rest, really. Sorry, I'm not introducing enough of what. So we're working in the northwest province of Zambia in a very rural area. It takes a very long time to get anywhere. It's probably about a 5-6 hour journey just to go to the cash point, or well, for international money anyway, or our food shopping. And we're working on a mission there that was originally set up by my grandparents about 60 years ago. There's a small team of us missionaries there. At the moment, there's about 12 of us, Zambians and British people. And we're working on many different projects in the community to support the local community, which is very poor. This year, the beginning of this year, I stepped into assistant administrator role in the hospital, the rural health centre that we're hoping to make into a hospital soon. So this year's been really busy for us, isn't it? We're also supporting the local church. Jon is often asked to preach on a Sunday. We've been working with the youth, building relationship and doing teaching and retreats and things like that. And there's many other things that we've been involved in, isn't there?
Yeah, fingers in many pies, as Beck said, with COVID as well, schools haven't been happening much, so we've been stepping in and helping some of the young people with teaching as well as homeschooling our own kids. Medical students that are studying, we've helped study when they've come back to us. I've been teaching in the hospital. As Beck said, she's been working in the hospital on the administration level, which is not just administration, that's human resources, finances, everything that you can think of that would help the hospital in any way, shape or form. Being ambulance drivers, feeding hungry people that haven't got food, our neighbours, anything that we can be a blessing to the community in any way. Basically in any way, shape or form, demonstrating the love of God to people in a practical way, as well as praying for them and with them, discipling people. So we're definitely kept busy in lots of areas of life over there, that's for sure. Yeah,
and we're part of a core group that are interceding for the nation of Zambia as well, and for the government of Zambia. So that's also something takes a lot of our time, doesn't it?
Yeah.
Yeah, but I most of you know who we are, and we just want to say thank you for all of your support over the last few years, and especially with the hospital and with the Satch 100 challenge. Your support has just been so valuable, and in so many ways your prayers have been so valuable to us, but your practical support and the financial support you've sent has just been incredible in helping the hospital function. The Satch 100 challenge has kind of been at a bit of a standstill this year because of COVID. It's been very difficult for people here on the ground to kind of fundraise and do events and stuff like that. But there's still stuff going on, and I know that people have been supporting in other ways. And I know you guys have been really helping with the Amazon wish list, sending things to our friend Claire, which in turn gets sent out to us. We received the last shipment. How long ago was that now? A few months ago. Yeah. And it was just amazing, literally amazing, unpacking all the boxes and sorting out our medical container, which is basically a metal container that we've turned into our storeroom at the moment. And we've been organising and sorting it all, and been using all the amazing things that otherwise we wouldn't have had, and it just makes such a huge difference to our patients. Yeah, we even sent PPE. Which has been brilliant, obviously. Thankfully, we haven't seen much COVID up in the rural places where we are. It's started getting there. We've had confirmed cases in the last couple of months, but it's very difficult to tell what's going on, really. I mean, and in terms of, people coming to our facility, there's always people with respiratory problems and coughs and everything else. So it's very difficult to know what's COVID and what's not, because we don't have the testing available, the test kits available.
And that's mixed in with, obviously, with a lot of malaria, TB, HIV, obviously on a big scale out there, all of those conditions. So mixing COVID in with that is obviously trying to test, see which condition it is. So it's a lot of major conditions that these people have to deal with on a regular basis anyway. So it's quite a complex picture in terms of healthcare out there already.
Yeah.
But without you, there would be no healthcare.
Yeah. So obviously, some of you know, we've basically been a rural health centre for a number of years, 40 odd years. And a few years ago, an organisation called Orchid Studio came and built us a new hospital building, very beautiful building, but it's standing empty, and we cannot be registered as a hospital until we have all the equipment for the hospital. So that's what Claire Brown started the SATS 100 challenge. That was to raise money so that we could purchase all the equipment. So what we've been doing in the last few months is just trying to start extending our services in little ways to help us get on that road, because some of the government people have come in and sort of made noises about, you know, if we could just get a theatre together, then they would, you know, they'd be much happier about signing us off as a registered phase 1 hospital. So for example, we were sent a new ultrasound machine from the DAC Foundation in Australia. So we've asked a guy from a local hospital to come, a sonographer, to come and do scanning on maternity patients every other week. So every other Saturday he's now coming, and we have dozens of women lined up every other Saturday to have their scans done at SATCH, which is so amazing, because usually we have to somehow transfer all these ladies to the local hospital every week, which is a huge amount of fuel costs, which we have to pay for, basically, the team on site. And we don't have government help with that. So there's so many reasons why having our own hospital would save money and save lives. Yeah, and I'll just let you know, because I think this is quite timely, really, but yesterday was quite a sad day at SATCH. We had news first thing in the morning of an emergency maternity patient that one of our team members had to race into the local hospital to have her baby. When they got there, even though they'd phoned ahead, the hospital wasn't ready for her. They couldn't find the keys to the theatre. There was lots of faffing about. And basically, long story short, we then got the news that the baby had died. And unfortunately, this is such a common occurrence for us at SATCH, where we're having to transfer out emergency patients, and it's such a terrible road. It's like a 45-minute drive to one of the hospitals, although the one that we're supposed to go to is a 2.5-hour drive. So yeah, it's just really sad that we lost that baby. And then later on in the afternoon, we got news about a child that we had transferred out to a missionary hospital that's about a 13-hour drive away, because they were very sick with malnutrition and gangrene, and he also passed away. And again, you know, if we had the facilities and the resources in our own hospital, we could have kept that child and, you know, potentially saved their life. So they're just some of the reasons why we're so desperate to get up and running as a hospital, and why we're so grateful to people like you for all your support and your prayers, because it really does help. And we know we're edging closer bit by bit to being able to keep patients with us and, you know, stop having to transfer them out, basically. Yeah. So,
but until the government signs you off as a hospital, you don't get a doctor, do you? They won't send a doctor to you.
Yeah,
so you have no doctors.
No, that's right. Yeah, we don't have any actual doctors. So it's really difficult, because we have very complex patients coming in every day. Anything from car accidents to heart attacks to, you know,
alcohol poisoning.
Alcohol poisoning, and people needing limbs amputated and all that sort of thing. And our staff are, you know, they're not completely equipped for that, because they're just, you know, just registered nurses, really. And what they do is over and above what they should do. So yeah, to have our own doctor would be life-changing, really, for so many people around. Yeah, so thank you. Yeah, so now we're just having a nice rest, and we've been in, we've been in quarantine for 2 weeks, and everybody's been saying, "Oh, how are you going to manage being in?" But actually, I've really loved it. Forced to stay indoors and not go out and do jobs and stuff. It's just been really nice. So, although the kids are starting to lose the plot, they're really looking forward to getting out the door now.
We break out on Tuesday.
Yeah, we're all
Tuesday.
going.
Oh, excellent.
Oh yeah, we're all. Yeah, we're counting the hours now.